Hello, this is Dr. Ikegami from iAnimal Hospital. Today I would like to talk about the treatment of tracheal collapse using nutritional therapy. Tracheal collapse is a difficult-to-treat disease with no known cause or cure. We explored the possibility of restoring a dog's trachea to a normal state. Even if the dog suffers from grade 4 tracheal collapse and is in a state of respiratory distress. This video explains that it is possible to achieve this through nutritional therapy. I feel very sorry, but I have the following request. If you don't want to give anything other than dog food, please stop the video and move outside as it will be a waste of time. This video may contain content that indicates the faults of the food you are currently feeding. If you do not want us to mention the food you are currently feeding, please close this video. This content is recommended for people who want to somehow help a dog suffering from tracheal collapse and who want tips on how to help. This video does not explain health management solely for the purpose of alleviating the symptoms of tracheal collapse. It is not intended to introduce the contents summarized in the review paper. This video introduces insane information about rebuilding a collapsed trachea. The level of evidence is the lowest level, which is a case report, i.e., presenting an individual's experience. Even if you consult with your family veterinarian, veterinary nurse, or groomer you know, it may be unlikely that they will agree. I will now show you a photo of the dog's X-ray. I will show you an X-ray photo of her area surrounded by this greenery. This is the direction from the side, the head is on the left. The tail is on the right, then the back is on the top, and the bottom is on the chest. This is a normal X-ray of a dog. This dog previously had tracheal collapse, and this is a photo of the dog after it recovered. The head is on the left, the back is on top, and the ventral side is on the bottom. The black part that runs through the middle is the trachea. This X-ray shows a dog's chest with a collapsed trachea. Please pay attention to the center of the yellow ring. You can see that this dog's trachea is narrow and obstructed. This is the signalment of this case. She is a 10-year-old Yorkshire Terrier who has been spayed. Her weight is 2.2 kilograms and her obesity level is 7/10. She tends to be slightly obese. The symptoms were grade 4 tracheal collapse, so dyspnea was observed. The treatment we used in this case was diet and nutritional therapy. Dietary therapy included a high-protein diet. For nutritional therapy, we use collagen supplements. For drug treatment, antibiotics and steroids were administered for 3 days each to improve respiratory distress. The dyspnea improved after 3 days. Now let's take a look at how this case has changed. Please pay attention to the area inside the yellow ring. I am showing you the radiograph of this case 67 days after treatment. You can see that the trachea is dilated. This radiograph shows 4 years after treatment of this case. You can see that the trachea is further dilated. For dietary therapy, we recommend feeding a high-protein diet. Please note, do not make sudden changes to your dog's diet. If you suddenly give them only meat, they may end up having diarrhea and not be able to accept it. Before starting treatment, I think it would be a good idea to check the functions of your internal organs. For nutritional therapy, choose a product you can trust. Even with a reliable product, it is necessary to start with a small amount and make sure there are no adverse effects, such as diarrhea or allergies. As for specific methods, it's best to start with feeding your dog cooked chicken the size of one of your dog's largest pads. Gradually increase the amount of meat topping each day. The recommended goal is to reduce the amount of food you are currently feeding by 50% and feed the same volume of meat as that reduced amount. For nutritional therapy, give your dog collagen supplements. This is the most important point of treatment. Please be careful here. Do not give supplements containing glucosamine and chondroitin, which are components of cartilage. In my experience, glucosamine chondroitin often increases coughing, so I think it's best not to use it at. So, what did you think of this case report? I would be very happy if this video was useful to you. Thank you for your viewing.